Between 2006 and 2015, almost 1 million Americans died as a result of suicide or drug or alcohol-related causes. The United States has more opioids per capita than any other country on the planet. These despair fatalities are particularly common in the American heartland, where manufacturing and other blue-collar employment have vanished. At the federal level, policy for opioid and related addictions has centered on protecting addicts from overdose death by increasing the availability of opioid antagonist drugs to first responders and appropriate medical staff. What has been lacking is a strategy that targets the epidemic's underlying causes by addressing both demand and supply. Today, we will be talking about America's opioid crisis. The United States is in the middle of a societal crisis. As one of the affluent countries in the world where death rates are rising, some recent data, and only Scotland reveals similar tendencies, though not on the same magnitude. Preventable fatalities of despair, suicides, drug overdoses, and alcohol-related deaths are mostly driving the surge among less than college-educated people in their middle years. According to a study done by the Stanford Lancet Commission on the North American opioid crisis, 1.2 million people in the United States and Canada will die from opioid overdoses by the end of the decade, adding to more than 600,000 who have died since 1999. The present opioid pandemic is one of the most severe public health disasters in modern history.
On this wall, we had 50 names in 2009, and now we're up to a little over 3,000.
It began in the mid-1990s, when the potent agent OxyContin, marketed by Purdue Pharma and licensed by the Food and Drug Administration, FDA, precipitated the first wave of deaths associated with the use of legal prescription opioid. Then there was a second wave of fatalities caused by a heroin industry that developed to lure those who are already hooked. A third wave of fatalities has lately occurred as a result of illicit synthetic opioids, such as fentanyl. Aside from the devastating public health impact of avoidable fatalities, millions more are affected by linked issues, such as homelessness, joblessness, truancy, and family disturbance. The figures are intimidating. Between 2006 and 2015, almost 1 million Americans died by suicide or drug or alcohol-related causes, with 127,500 dying in 2015. According to the most recent data from the Centers for Disease Control and Prevention, overdose fatalities finally began to decline in 2018, yet there were still 68,000 deaths. The United States continues to have more opioid per capita than any other country in the world, and more individuals report having experienced pain in the previous day than respondents in 30 other countries. Meanwhile, the phrase deaths of despair connotes an economic or social catastrophe rather than a health problem. It is all three, and it is influenced by both supply and demand. Since the 1970s, the decline in manufacturing has disproportionately affected certain regions and communities. According to Justin Pierce and Peter Schott, the mortality crisis struck industries where Chinese competition was most intense. In general, it shows an increasing tendency of automation displacing low-skilled occupations. The same towns that witnessed significant drops in employment also showed decreases in marriage rates, increases in the percentage of prime-age males out of the labor force, greater rates of reported pain, and higher rates of opioid prescription. The latter two trends are related to the health consequences of industrial and mining employment. Higher levels of reported pain and opioid usage are partly the result of strategic supply methods implemented first by the pharmaceutical sector and then by drug traffickers. The result was literally a perfect storm. At the federal level, policy addressing opioid and related addictions has centered on protecting addicts from overdose death by increasing the availability of opioid antagonist drugs such as naloxone to first responders and appropriate medical staff. While more extensive attempts to prevent suicide have existed for years, such as the work of the Substance Abuse and Mental Health Services Administration, they have gotten little support from the current U.S. administration. What is lacking is a strategy that targets the epidemic's underlying causes by addressing both demand and supply difficulties. While the oversupply of opioids has become a legal issue, such as the action in New York against the Sackler family and Purdue Pharma, the Trump administration during that time didn't make much of an attempt to address the underlying issue. The action against Johnson & Johnson, for example, was filed at the state level, Oklahoma, and it is unknown how much of the settlement proceeds would go to the victims versus paying legal bills. There is currently no comprehensive policy solution to the more complex demand problem. Addressing a desperate crisis defies most normal policy definitions and remedies. Understanding differential resilience across demographic cohorts is even further distant from contemporary policy debates. However, the underlying reasons of the problem, the loss of the working class, the disintegration of families, communities, and social capital, and the inefficient public healthcare system are not going away, and worse, are likely to spill over into the next generation. Many adults who are addicted or have died from despair, for example, have children who are showing indications of stress as a result of events ranging from general maltreatment to witnessing their parents' overdoses. Such events will follow them well into adulthood.
Initially, this problem began with heroin, but it has since morphed into fentanyl. Fentanyl is a much more powerful version of heroin. It's synthetic. It's made in the lab. It's not grown organically like the poppies are that can produce heroin.
The opioid overdose crisis killed more than 100,000 Americans for the most recent year on record, the most ever. It's being called one of the most pressing national security and public health challenges facing the U.S. And these overdoses are costing the nation an estimated $1 trillion a year.
Prescription drug misuse is second only to marijuana as the nation's most common type of illicit drug use. As a result, understanding the occurrence of and reasons for prescription drug misuse has major public health implications. Policymakers can use this type of information to help inform their assessments of substance use prevention and treatment needs in their communities. This report uses data from the 2015 National Survey on Drug Use and Health to provide up-to-date information on estimates of past year misuse of prescription drugs and reasons for the most recent prescription drugs misuse for adults aged 18 and older.
Rising levels of addiction to prescription drugs and the men-only cancers that could be prevented if half the population talked more about their health.
About 91.8 million adults aged 18 or older were past year users of prescription pain relievers in 2015, representing more than 1/3 of the adult population. About 11.5 million adults misused prescription pain relievers at least once in the past year, and their most reported reason for their last misuse of a pain reliever was to relieve physical pain. About 5.7 million adults misused prescription tranquilizers at least once in the past year. The most common reasons for misuse the last time were to relax or relieve tension and to help with sleep. About 4.8 million adults misused prescription stimulants at least once in the past year. The most reported main reason for the misuse of stimulants among adults who misused stimulants in the past year were to help be alert or stay awake, to help concentrate, and to help study. About 1.4 million adults misused prescription sedatives at least once in the past year. The most common reason for the last misuse was to help with sleep. This study highlights that most people who misuse prescription drugs are doing so for the very reason that the substance is typically prescribed, and comparatively few were misusing the prescription drug because they were trying to get high. However, the misuse of many of these prescription drugs, such as prescription opioids, has documented risks, such as dependence, overdoses, and death.
Its addictive nature is one of the reasons why it's only prescribed in small quantities with no refills. There are multiple dangers. I mean, pain medication, although it's one pill, is oftentimes not just one medication. For example, if you use Vicodin, that's hydrocodone and Tylenol. Now, if you take 3 times the recommended dosage, you're taking 3 times as much Tylenol as you should as well.
How can hope be restored? How does one teach resilience? This is not an easy endeavor, but there are lessons to be learned, the majority of which originate from local initiatives. According to new studies, desperation can be reversed. Increased access to volunteering, the arts, and shared green areas, all of which improve feeling of purpose and minimize loneliness, are examples of interventions and simple programs that help individuals have better outlooks. Interacting with members of the community improves the well-being of those who have retired or fallen out of the work market, or are otherwise isolated at home, subject to sadness and despair. Researchers and the city of Santa Monica collaborated in 2015 to create a well-being tracking index and related actions in that city. When the poll indicated social isolation as a sign of low well-being, the city reacted with community involvement activities.
Santa Monica was the first city in the world to do this.
There's no other local government that's ever done this.
Weekly group walks, library trips, and art projects were among the activities that had measurable impacts on well-being. In general, metrics are essential for defining trends and identifying the susceptible.
Of wellness and our physical health, we're really using it in the civic context. So what is civic well-being? It's creating a city that puts into place conditions for every member of that community to thrive and flourish.
Economic opportunity, mobility, civic engagement.
It's about maximizing potential.
Can be measured and it can be improved.
In my home state of Maryland, the Maryland Behavioral Health Administration provides programs that teach children growing up with addicted parents how to be resilient, which includes instilling a feeling of competency, problem-solving, and coping skills, among other things, from preschool through adolescent. Be Well Orange County in California is establishing similar initiatives for people of all stages of life. To be effective in the long run, such treatments must also address the underlying reasons of despair, such as a lack of job, a feeling of purpose, and hope for the future. These same factors make people more vulnerable to addiction. While minimizing isolation and offering purposeful involvement are helpful techniques for older persons who are unlikely to re-enter the labor force, it is critical to complement these programs that prepare the next generation for employment in a fast-changing environment. Communities, or their lack thereof, play an important role in the linkages between despair, addiction, and premature death. The University of Louisville's Center for Creative Place Healing is one example of a community-wide endeavor to increase well-being. This center promotes the growth of human capacities for innovation, such as vision, teamwork, and perseverance, and strives to connect these activities with community-level initiatives to increase well-being. The center's initiatives are based on detailed reviews of experimental programs. Of course, there are several comparable initiatives taking on around the country. A federal-level initiative to collect collective evidence and make it available to politicians and non-governmental groups across the country would be a low-cost way to get the process started. A greater step, of course, would be establish a framework for providing government taxes to support such activities on a regular basis. Although some 2020 presidential candidates, such as Pete Buttigieg, have offered systematic funding for efforts to solve basic challenges, such suggestions are still in the early stages. Other contenders, such as Bernie Sanders, advocated for remedies to trade-related economic challenges. The unresolved issue in this crisis is the intersection of the economic, social cohesion, and mental health. There is no solution, and the debate is plagued with false claims and misinformation. One beginning measure that might yield significant results is to incorporate well-being metrics into our national data collection. For over a decade, the government of the United Kingdom has included 4 questions in its official statistics that include life satisfaction, meaning and purpose in life, worry, and contentment. These questions are brief and easy to administer. Nonetheless, They may be used to measure national well-being and ill health. If similar warning indicators had been there earlier in the United States, we would not be confronting a crisis of the magnitude and complexity that we are now experiencing in terms of our nation's health, civic discourse, and politics.